we're going.
Hey, it's Rachel. I'm going to be doing my newborn assessment video. I'm going to be using a teddy bear as my newborn in this, and as my teddy bear is blue, we're going to go with the fact that it's a boy. I will come into either the nursery, or if he's in mom's room with her, I will have done my hips already. And so coming into the room, I will begin my assessment by making sure the room is warm, and also that he's on a blanket, and there's nowhere, like there's no air moving or anything that could make the baby colder than he's going to be when he just has his diaper on. So beginning my assessment, I'll come in and just looking at the baby first off. How does he look? What's his demeanor? Is he in the flexed posture that babies like to be in to keep warm? What does his skin tone look like? Is he pale? Do we have any cyanosis? Is there any evident trauma from birth offhand that I see jumping out at me? As my little guy is calm and asleep right now, I'm going to start with my vitals before I make him mad. So I'll start with a heartbeat. I'll come down and I'll get a heart rate at the apical, my apical pulse, and I will hold that for 60 seconds. I want to make sure that I do count that for the full minute, and that his heart rate is between 110 and 160 beats per minute. While I'm listening and getting his heart rate, I want to take a listen to, do I hear any murmurs in his heart, what the rhythm is. And then once I have that, I'm going to listen to his lungs and each of his little lobes. Want to make sure he's got clear lungs. Does it sound like he's got any fluid in there? If there's any wheezing, or it looks like he's having trouble breathing. And I will count his breaths per minute for a full minute, as well as they should be between 30 and 60. Once I've listened to his lungs, I'm going to go ahead and listen to bowel sounds in each four of the quadrants. I want to make sure I have sounds in each quadrant. And while I'm doing that, I will assess and find out if he's past his meconium at that point as well. Once I have listened and don't need my stethoscope anymore, I'm going to get an auxiliary temperature on him. Little guy's temperature should be 97.7 to 98.6. Perfect. We're in a good range. So now that I have my full set of vitals, I'm going to measure him. First off, we're going to get a weight. Now with the weight, I will have a drape on the scale, and I will have tiered the scale so it's 0, and I'll put the baby on there to get a proper weight. Average for newborns is between 5 pounds 8 ounces and 8 pounds 13 ounces. And so we'll get that information. Once I have the weight, I'll take the baby off the scale and put him back on table, warmer, something to that effect, and I'll get a length. This will probably make him mad because I'm going to have to unflex his little leg. I want to go from the bottom of the foot all the way to the top of the head. Newborns' average height is between 19 and 21 inches. Once I have that measurement, I'm going to do a head circumference. Head circumference usually is about 13 to 14 inches, and it's measured at the brow line. Perfect. He's at 13. Wonderful. And I'm going to come down and do a chest circumference at nipple line. Chest circumference should be about an inch less than the head at this point of the newborn stage, so between 12 and 13 inches. And then do an abdominal circumference as well. Perfect. That will be right above the umbilical cord, right above his little navel there. once I have that information, I'm going to also keep in the back of my mind his APGAR scores for 1 and 5 minutes. More so the 5 minute, just to see how well he's adapting to life outside of the womb and if he's still continuing on that path. By now I've made him mad so I can hear he's got a good cry. His color looks good. He has no signs of cyanosis. He went right back to his flexed position. So his muscle tone is good. His reflex, his heartbeat is strong when I listen to it. And so now I'm going to start at the top of this little guy, just looking at starting at his head. Is it symmetrical? Do I see any bruising, any lesions? Was it an assisted delivery, forceps, a vacuum? Was it a vaginal birth? So does he have some modeling on his head? And then I'm also going to check the fontanelles, check his anterior fontanelle, which is the big one in the front, and then the posterior fontanelle. Also wanting, when checking the fontanelles, that they're not depressed, indicating possible signs of dehydration, and they're not bulging, potentially being increased pressure in there. Once I've done that, check his ears, make sure they both look good, and then check his eyes. They clear, they cloudy, and that the eyes line up with the top of the ears as well. Take a look at his nose. Do we have, two nostrils? Looks good. And I'm also going to check his mouth. Put my pinky in and feel the roof of his mouth, and check in his palate. See if we've got, a fused palate from what we can tell. But this is also going to test and see the baby's sucking reflex. I'm also going, after I've done that, to check his Moro reflex, which is just stroking the baby's cheek. And ideally what I want to see is the baby to turn his head towards that stimulation. Come down, feel his neck, check out the clavicles, see how those are feeling. Look at his arms, pull them out. And I would also check and see if I can feel brachial pulses on both arms. Come down, check his fingers. Want to see, 1 thumb and 4 fingers on each hand. See some fingernails. While I'm here, I'm going to check his palmar reflex. With that, me just putting my finger in his hand, I want to see the baby kind of see if he can grab that. Looks good. Keep working my way down, looking at his chest, checking to see how he's breathing. If he is having a hard time breathing, do we have retractions? And then keep working my way down. When I get to his tummy, I want to see a protuberant belly, since babies don't have muscle tone. I'm also going to look at his umbilical cord. How does it look at this point? Can I still see the 2 arteries and 1 vein? I know that was assessed at time of delivery when the cord was cut, just checking, also seeing the site. Is it showing any signs of infection, any drainage? Is it red? Is it hot? Is it anything out of the normal? And work my way, keep coming, check, make sure he flexes both of his little legs, and I'll get femoral on both legs as well. Keep coming all the way, and I want to see, check his feet. How do his feet look? Are they inverted? Does it look like he has a club foot? Check, make sure I've got 10 toes, how his little fingernails or toenails are doing. While I'm here, I'm going to check his plantar grasp. So same process as with the palmar grasp, but put my hand underneath his toes, and I want to see him kind of try to move them towards me. I'm also going to check Babinski. So that's stroking, taking my finger and stroking the outside of baby's foot, and I want to see the toes hyperextending, kind of fan outward. Once I've done that, I'm going to come back up and I'm going to check, just make sure, I'm going to check his spine. So with babies, you got to be careful of their head. So I want to get him, kind of turn him over as I can. Keep him up and just make sure his spine is straight. There's no signs of any abnormal curvature. There's nothing standing out of the ordinary on the back there. And then lay baby back down. And now I'm going to check and see. I'm going to take his diaper off just and check his penis, make sure it looks good. Check and see if, while I'm doing that, has he been circumcised? Is he going to be circumcised? Use that, you know, possibly as a education point for the mom and dad as well. I'm also going to check his testes to make sure there's two and that they've both descended. So check that. And I will also cover, after I've done my quick look, I will cover it back up just so I don't get sprayed in the face. I'm also going to check and make sure he's got, you know, his anus is not perforated, and all looks good. So then put his diaper back on, and I've got to check his startle reflex. So with the startle reflex, that's the Moro reflex. The cheek is the rooting reflex. I just caught myself. So the rooting reflex here, the Moro reflex is the startle. I won't forget that now. So there's a couple of ways you can do the startle reflex. You can make a loud noise, which I'm not a big fan of, but if you kind of you want to change his, you know, you're kind of throwing the baby off guard a little bit. So if you put the baby back down, but bring his head down first just a little bit, he should extend all his extremities out and come back in real quick with like a C grasp. So he fans out and comes back in. Perfect. So all of his reflexes seem to be intact. His skin looks good. He's peed. He's past meconium. Umbilical cord shows no signs of infection. Vital signs are within the normal range. I've got all his length, weight, everything has been documented. His general appearance, he has no abnormal coloration. So at this point, I will take my little guy and I will swaddle him back up and give him back to mom and document my findings. Thanks for watching.